So today is a 22nd October 2024. We'll be taking session on epidemiology also now. We have taken enough on statistics, but before we start the epidemiology, particularly case control and core study, we'll be going through analysis of Excel file. So I will be sharing. So the Excel file which was shared with me is like this. Actually, it was and there was a header a blank that I deleted, and I also saved in a old version of Excel because the AP info may not be able to take the latest version of Excel. Now, once this data is there, we need to know the headings. So this data is submitted by a participant. So actually the for analysis purpose, we need only ID and the name actually should not be kept for the data analysis, but ID should be kept. So if you require, you can get it, right? And other thing is you should know the heading. Ideally, heading if you like congenital constitutional symptoms, if you like this constitutional symptom rather than the whole different words, the short form will help us. Morning stiffness, for example. So you keep it like this. Morning stiff. That should be sufficient to understand that this is a morning stiffness. So it will be useful in analysis. It will be easier to analysis. And last is serum creatinine level. And there should not be any in file. The decoration should not be there. Merge cells should not be there. File should be clean. Here we have a six data. Suppose there's the same file. If it would have been shared in the Google Form, we can circulate to other colleges also so that we can get more data. Anyway, this is the data file. Right now, we'll be using the uh, frequencies, tables, etc. Means command also we can use it. So now you take a heading in another file like this. And the same thing. First, now serial number you're not going to take in analysis. Name also you're not going to take into analysis. So delete this column. This is a simple procedure to understand, but very useful for teaching UGs and PGs. Which tables are to be compared? This unique ID also we are not going to take in analysis. What is the TJ and SJ? If you can clarify, that will be better. Then the limbs are almost all the limbs are same. So this will not be help us in analysis. So we may have to delete it. Huh? Also, everything is RF is always positive. So we are not going to compare with anything else. So all these things which are not going to be helpful in analysis can be deleted because there is no point in comparing with something else. Now, these are the data which you are going to compare. And now transpose this same thing. This is a prerequisite of before you start any analysis. Transpose. And once you transpose, now you can see that the data can now, what kind of analysis you want. That is the thing which you should be considering. Now, the total number of cells are 4, 4, 8, 10. 10 variables are there. So, how many small joints? TJ means total joints. Okay. Okay. So, this is a small joints and this is a total joint. But what does it mean? 8, 12, 9, what is that? That can also be, you should tell us that. Now, because these are 10 and these are the 10 values. So if you go for permutation combination, how many tables are possible? Can you tell me in chat? We have 10 variables, right, for analysis. So if you can do the permutation combination with the same 10, so sex versus A, sex versus TJ, sex like that, no? SJ with A. If you do this, how many tables or how many analysis will be there? How many tables, which includes 2 by 2 variable, right? It could be a means command, it could be a uh, see table command which we may be using characteristic by characteristic, right? So how many such tables will be there if 10 variables are there? Anyone? There is a equation is like this. Total number variable is 10. So 10 into 10, 100 minus 10, right? So is equal to 90 and divided by 2. So you will have 45 tables. This is the first thing you should be doing before you start your analysis. Now, let us see why it is like this. Very simple. See, this will be a frequency. Sex versus sex, there is nothing like analysis. It will be a frequency. There is nothing like age versus age. So all this will be a frequency. So total number of table are 10 by 10. So 100 cells are there. Out of this, 10 will be the frequencies of the same variables. So out of 100, 10 tables are not existing. Okay, you cannot derive that. So remaining 90, 45 on this side and 45 on this side. This is a mirror image. So 100 minus 10. So remaining 90, 45, 45 is the mirror image. So we have total 45 cells to decide whether we want to include in analysis or not. That is the first step before you start your analysis. Now, where so first upper half, let's say you are removing, so you are not considering this, right? You are not considering this. Cancel, cancel, cancel. So this is also all others are cancelled, right? I'm not writing like this, but the upper half is cancelled. Now you start thinking about this. Out of these 45 cells, which are important, would you like to compare the mean age versus gender-wise mean age? Would you like to consider this? If you think yes, it is very important, write A. It is not important, then you may write C, right? And in this command, what command you are going to use? Means command you are going to use, right? Then this which command can be done later also, C grade, or you can give a score. If it is very important for you, give a 10. It is not that much, you give a score of 3. Let's say sex versus age, maybe you keep it a very less important 3. Then TJ and sex, yes, it may be important, keep it a 5. And mornings, if the male versus female, I think this is a very important. Then you keep a 7. And constitutional symptoms, you keep it, let's say, 4. ESR, you want to compare, is not, or sex size difference may not be too much. So like 2. And UACR, what is that? UACR, can you tell me what is UACR? That, let's say, keep it as a 2. And same creatinine also 2. This is a what you compare sex versus the rest of it. Now, age versus TJ, you would like to compare. Yes, this is for age, it is very important age wise. Then you keep it like this. Very important. So, this is a scoring system to find out whether you should go for it or not for the purpose of analysis. Albumin creatinine ratio. So, now once you do this kind of scoring system, which one you want to do it, then the most important thing you should be doing first in analysis, because there are 10 variables, there could be a 50 variables. Suppose you have 50 variables, how many cells you need to look like this, whether important or non-important? How many cells you need to consider? Can you tell me in chat box? If you have 50 variables, then how many cells you need to look at? 50 into 50, that is 2500 cells will be there. And then you need not look all the 2500. You minus 50. 2050 will be there divided by 2. So you will have 125 cells. Now, 125 cells seems to be a very huge number. So in that case, what you should do, that only take out of 50, only take 40 variables which are very important. Then the cells will be reduced for the purpose of analysis. Now let's go actually for the purpose of analysis, what to be used. Now in this case, if you want to compare, let's say, age with anything else. So with ESR, if you want to compare age, you will be using regression command. If you consider symptoms, yes or no, in that case, you'll be using means command. And so you should know that if we have the characteristic versus characteristic, that means category versus category, if you're going to compare, you should use table command. But if one variable is where you can have you can find out means, and other variable is something where it is a category or characteristic, right? So in this case, you should be using means command, in which you should take a variable which is cost, from which you can find out mean, and next variable should be like gender, right? Where you can is a characteristic variable. This is how you cannot use this over here and age over here. That is not feasible. But if you have both the command where you can find out means, that is continuous variables are there and another also continuous variable. If two such variables are there and if you want to compare that, then you can have a regression equation. So use the regression command. This is how your analysis should be done. So now actually we'll try to do this on the file which is given to us. So this is a file. This sheet one you can rename for analysis. Analysis. And before you do the analysis, you should always take a backup file so that even if you make some change, original file remains the remains with you. And then get a copy. And you can write this is a backup file. Backup sheet rather. Now let us try to do it in AP Info. Now we start AP Info like this. I hope that by now all of you are having AP Info. It's very, very simple to use. You go for the classic for data analysis. Then we use the read command. You select here instead of AP Info project, select XLS file and now browse. Again go for browse. And our file is in desktop. This is the file. Let's say OK. All the four sheets are there. I'm going to do the analysis file. All the six records are now selected. I hope it's so easy to do it. Now, the first command which you're going to use, you can use the list command to look at the data. You can see data like this, right? Then the next command, frequency you can use. Frequency star will give you the analysis like this, right? Once you look at this frequency, you will know and what is the thing. Now in this frequency, how to read this frequency? If serial number is duplicated or not. One data is entered twice, thrice, that you can know it. Name also you can find out whether it is. It can be duplicated because a two-person can have same name. Now in this case, there's one female and five male. Now can anyone tell me this is 16.17%? Now if you do the actual study, let's say these are the six individuals. Instead of that, if you take a sample of 100, this is a very good question for you to understand that suppose instead of six, there's a one female out of six. Suppose if you take 100 such population, what will be the percentage of female? What could be the likely percentage of female in population of 100? Can you tell me? I write down the question in the chat. See if there is one female in sample of 6%, then if population is let's say 200, then What is the likelihood? What will be the what will be the likely number likely number of female in population? Can anyone give me the answer? Answer is there. Provided you can read this answer. Anyone? Data is there. 6 में से एक फीमेल है तो 200 से कितना हो सकता है? Very simple question. If you can do the use of the data given by AP info. Anybody? I think, can you see this screen? It is 0.4264%. That means 0.42 is almost near, let's say 1%. So out of 200, 1% is almost 2. Or even you can say half a percent is only 1. 1 to 64%. That means 128 female would be there in sample in population of 200. This is a no, this is used as standard error of proportion. Based on a sample, we want to talk about the population. We are using this standard error of proportion. So, and based on that, the AP info has given you this values. For male, it is 35 to 99%. It is given like this, right? So, this is how you can use the percent given in the analysis. So we go to the next, the age. If you look at the age, now in their age, they have given as it a separate data is there, but they have not taken as a mean. So if you want to have a mean of the age, you can take over here mean of age. Huh? And they have already given data over 6 data. Mean is 49 years. This you can find out separately also. Now let's go for the tables command. Tables command, you have category versus category. So one category is morning stiffness versus gender. Usually when you are writing scientifically, usually we should be using the word gender. And this is the analysis. Morning stiffness. Now in this case, morning stiffness is a continuous variable, is not the uh, characteristic variable. So we forget this tables. Uh, in this case, what is I don't think is there any other name, small joint. I think all the variables are probably limb is also only one limb is there. So there is no point in doing analysis. So here practically tables command is not usable because there is most of them are the command which are suggestive of the measurement variables. So we should be using the command only sex is the thing. So means command only usable, right? Or you can go for regression. So means age versus gender. This is whether the difference significant or not that you can find out because the sample size is so low, it is not giving, right? Then you can give another thing means of the creatinine level or small joint or total joint you can write versus gender. The analysis will be like this. This is the mean of the uh, total joint 6, 8.4, like this. Here, mostly what you can use is a linear regression can be used, but the data is very small. That's why there is a problem. Suppose you say the ESR is the outcome and versus age, then regression coefficient we will have, right? And this will show you the whether they are both are correlated or not. In a very small data size, you can see the correlation coefficient is zero. So there is absolutely no correlation between these two variables. Now, if you get a large data set, 100 or 200, you may get somewhere over here. So linear regression you can use between various things. You can say the total joint, or instead of that, let's say the C-reactive protein versus the ESR. And here is 0.93. So they are very much correlated. If CSR is increasing, the C-reactive protein also increasing. They are very much correlated with each other. This is how it can be seen. And the so this is how you can do the analysis of Excel file. If there is any question, I can answer, or we will go to the case control and power study, which some of you should be doing. Any questions so far? So let's move, stop sharing, and go to the file. Uh, any question? You will be able to do the analysis in Excel file, right? So I'll be sharing another file on case control study. I hope all of you have read screening by now, so that we can do something more than that. In master chart, they have to mention all cases, serial number, not in master chart, they have to print all the cases, including serial number, name, everything. But why do they their analysis? In analysis files, case ID should be kept, name of the patient, etc., should be removed, I guess. Now, few minutes for now. If you don't have questions, now let's see that we are going to do the case control study and then the cohort study, right? So now the word case control study, even if you, it doesn't mean that you need to have cases in means there has to be some disease, right? Case is basically an outcome, outcome present, outcome absent. In case of your anesthesia, what is the outcome, right? Outcome can also be considered as a case. And control, where there is a that outcome is not present, something else. Typically, in case control studies, suppose you have patient having cough, patient not having cough, or person not having cough. There could be three possibilities. Suppose there is a patient of fever, then patient other symptoms other than fever, and no symptom. If you have a disease, diabetes, other disease, no disease. There could be, it's not only that there could be only one control. For a one case, there can be two, three controls also. And as far as the number is concerned, as far as the category is concerned, there could be multiple category also. So what are the features of case control study? Now, when I ask this question, we should have plenty of examples to learn. I want to find out the depression versus no depression, or rheumatoid arthritis versus no rheumatoid arthritis, diabetic versus no diabetic. But when you are comparing all this thing, and you want to find out the exposure, why this could have happened at that time, there are various, yeah, cancer lung, but cancer lung usually we find less number, right? So in a practicality, you take a small things which is easily, for example, spectacles, myopia versus no myopia, right? Or you want to take, let's say, the fatigue versus no fatigue. Such thing can be taken. Now the features is exposure and outcome have already occurred before you start a disease. You have outcome with you. So exposure, which you think that the exposure would be like this, that is already happened. Study proceeds backwards from effect to cause. Effect is already there. So you say, ask the question in the past, what you are suffered from, so you are exposed to this or not. Use control group to support or refute an inference. So control group usually we are taking as those who are not suffering from the disease. This is how you are going to take. Now, what are the steps of the case control studies? And we'll also look for the cohort studies. Now, typically, while we are taking these basic steps, let us say that we take an example typically of, let's say, dengue. Dengue cases are there and also control those who are not suffering from dengue. In case of this, we should be taking that care that matching should be there. Control when you take, right? So if you take a dengue cases having an age of, let's say, middle age, 45 years or 42 years like that, and control you are taking 80 years and 90 years for children having 4 years and 5 years. So it is not a matching, age-wise matching, socioeconomic matching, etc. should be there. Then measurement of exposure. In case of measurement of exposure in dengue, we want to know the exposure to the mosquito. And when you measure the exposure of the mosquito density you can describe. You may not be able to measure because it is retrospective. Now, patient habit, whether they, what kind of clothes they are using, on which floor they are staying, like this. That kind of history you can take. And then there will be analysis and interpretation. Remember that in case control study, you don't have the population with you. And because you don't have a population, you cannot find out the relative risk. Because to find out relative risk, you need to have the population, right? And that's why we are not finding out the relative risk in a case control study, but we are going to find out odds ratio. Because in exposed and not exposed, that way we don't have a data, but we have data reverse way. Here are the cases, these are the control in which they were exposed or not, like this. So total population we don't have, and that's why we cannot go for relative risk, but we are going for odds ratios. So when we select the case, our diagnostic criteria should be clear cut that these are the cases which are going to take, and eligibility wise, whether the supposed patient is in ICU, you may not include that kind of cases. So eligibility you decide based on your feasibility, right? Then the sources could be at a single hospital or the multiple hospital, or it could be OPDs, or it could be the peripheral rural health center, urban health centers, it could be a general population. Now you may feel that can I take such cases from the school or not? Now school hardly such cases will come to school because when they are having dengue, they will not come over here. But then in school children, you can ask, do you have any parents are suffering from fever right now? And then you can go for the testing. And if you find a dengue, then you can take like this also. Selection of control, the person should not have that disease or that outcome which you're going to study. And as far as possible, the rest of the criteria should be as much as the patient is having, age wise, or let's say social condition, occupation, wherever it's possible, you try to control those the confounding variable. Confounding variable is one which is related with outcome also and which is related with the input or the variables which can affect or which can bring the outcome. So input variable, output variable, if it is related to both compounding variable, then uh, it should be matched for that. For example, if you want to take a, let's say you are going to take dengue cases, only the rich population and versus poor, right? Then rich people might be using mosquito net, poor people may not be using. So using the mosquito net or not using that is that can have effect on the richness of the person, and that may affect the lifestyle, and that can affect the use of mosquito net, and then there could be difference in dengue versus no dengue. So that's why social condition which I should try to match. Sources of control you can take from your siblings or relatives, neighborhoods, general population, schools, colleges, like this. Depends on the case, right? If you have young cases, you can find out from school colleges. If you are old cases, you can find out the vicinity. That is possible. Right? Uh, there's a very interesting the question right now. If you want to find out whether the condition is genetically related or it is related to environment. If you want to find out the difference, if you take the same family members, there could be genetic also, and there could be the environmental factors also because they are seeing the same family. For such kind of things, if there are twins staying one over here, one in the foreign countries, then environment is changing, gene remains the same. So, like this, you can find out the same family members, right? Same family, some of them staying outside, few stays over here. At that time, you can compare genetic versus environment. See, the ideal case control ratio is 1:1, but many times the control is not, control is freely available, while cases are not freely available. At that time, a bit one or two or three, up to three, four times you can take controls. Now, matching is a process where you try to remove the effect of confounding factor. We already now the measurement of exposure. Now, in this retrospective history taking is very, very important. You need to ask in the back of the mind that 3 years ago, 1 years ago, or let's say 10 days ago, in case of dengue, we'll be asking history, past history, let's say for up to last 1 month, sleeping habits, eating habits, the visitor traveling, etc., etc. That you can be doing that. Then the question can be there. There could be a Google form, and or you can also bring the past record of the hospital. You can take the lab reports, etc. You can ask the doctors, treating doctors, etc. That is also possible. Now, odds of exposure among cases, odds of exposure among control. This means odds ratio of the odds. Odds means exposure. How many people were exposed in cases? Was it how many people were exposed among controls? So that's why we are taking this ratio of the odds, right? So that will give us not exactly relative risk, but suppose this odd ratio is 10 or 15, that means it's very, very, there is a lot of association between this cause and the effect. If odd ratio is only one, that means both are same almost. So there's least likely that they are associated. And that's why we are using this odds ratio. Any questions? So now, uh, I think one kind of case control study uh, you should be writing on chat box that which in your case, in your area, in your setup, which kind of case control study you will be taking. I will give another example. Nowadays, hair fall is a very, very common thing. Hair fall versus no hair fall. This study can be taken. Similarly, you should also write down one thing, right? And in that, various factors you will be taking. You will take talked about the diet, you will be talking about stress in the life, you can about sleeping habits, the what kind of shampoo the person is using, what kind of oil the person is using, whether the person is doing dye or no. All such kind of factors you will be taking exposure factors. So can any one of you write down which kind of case control study you can do it, or you can write down designations and I will write down for you. Let's get involved yourself. Which kind of case control study you can take. If you are a physician, naturally you will having hypertension versus no hypertension and compare the lifestyle, etc., etc. Then you are a physician, you daily get a lot of patient. You can get obesity versus no obesity. So when you go for such studies, in go detail from where I can take sample, how much samples I by default, if you are capable to go for 400, if you cannot go for 400, take 100. And that is also not way. At least take minimum 30. But if you are not able to find these 30 cases, then you go for even 10 or 15 cases, and then you go for the non-parametric test. Right? So now the next thing is cohort study. In cohort study is more powerful than the case control study, but it's time consuming. You find out those people are exposed and not exposed. For example, the people are using shampoo of a particular brand, and other people are using another brand, and third person are using natural things. So all the three cohorts can be compared. Four or five cohorts can also be compared, or you can control two cohorts also. Right? But in this case, in cohort, you are taking exposed and not exposed. In this case, there could be so many confounding variables are possible in cost study, right? So when you want to go ultimate study, at that time you are going for randomized control study. So there's nothing like cohort at that time. You have one population. Out of that, you segregate randomly into two groups, then expose one group of person, don't expose to other group, and don't do the follow. So because your randomization is done, it is known as randomized control trial. While in cohort study, automatically there's a group of exposed and not exposed. There is no randomization. So cohort study is better than case control study because you are doing progressively. You can meticulously record what are the causes, what are the affected, the effective, the factors which are affecting that you can measure meticulously. You can also have outcome in detailed manner. Also, you can find out the relative risk, attributable risk, because you have now beforehand you have population from which you are getting a data. So case controls, the cost study is better than case control, but in cost study the problem is the when you study for example, people affected with silica, but those who are working in silica, they are a poor people, maybe because of that. So, and when person not working in silica, they may be poor, but less poor than the people working in silica. Then so there's a likelihood that the cohort when you expose the along with the exposure, there could be other factors which are intermingled with the exposure. So when you are doing a randomization, when you are totally taking a one population, dividing them into two, and now artificially you are adding some experiments, are doing exposing to something, right? Now, randomized control trial when you're doing, usually we are doing some treatment because it is unethical to expose to something. That's why when sometimes we are using the natural randomized trial. So naturally, when they are uh, affected because of some reason, for example, the 100 population is there. Out of that, we say that randomize into two groups. One group, all the 100 are going to go for, let's say, mines. But out of that 50, we say that we are going to give you alternative occupation for the sake of study. That is, although the people were ready to go for the mines, but now we are giving them alternative occupation, and then we can compare. So, thus, such kind of randomized control trial can also be done. Now, in core study, we have initially in this design, selection of study subject depends upon exposure status. We begin with a group exposed to particular risk factor and another group which is not exposed to risk factor. Now, what are the factors what are identified prior to the appearance of disease under study? So you can meticulously find out the incidence of disease, you can find out the prevalence of the disease. Is it? Study groups are observed over a period of time to determine frequency of disease among them. So exactly every week or every month you can do it. For example, we in one of the taluka, Petla taluka, and the village name was Dharampur. When I was in a medical college, we did a long-term study for the outcome of Framingham study. So like Framingham study, we did in our Dharampur. So we did the incidence of diabetes, hypertension, obesity, etc. And continuously every week we used to go to that Dharampur village and we did study like that. And study proceeds forward from cause to effect. And conventionally the risk factor is one, but disease can be more than one. Now, in this case, when we do a large study like this, which we carried out in Dharampur, it was not one to one. There were various risk factors we were evaluating and various disease outcome also we were evaluating. So in this case, when we have large such study, and then we can do the analysis, exposed, not exposed, this is outcome, not outcome. So in such large studies, we can do a lot of things. You might have heard the word nested case control study. Nested means within that analysis frame itself, you can do that kind of sub study also. So the disease they have written the risk factor is one, but diseases can be more than one. In our case control study, disease was one, but there may be multiple risk factors, right? But it could be like this: multiple risk factor, multiple disease that can also be evaluated. Now, the most difficult to understand is prospective cohort study is easy to understand, right? See, we start with the risk factor yes and risk factor no, right? And then we follow them up. But when we use the retrospective cohort study, the thing is difficult because you need to find out, let's say in my society, if I'm doing retrospective cohort study of Shadanagar cohort and the Sada society cohort, then 5 years back, if I want to start retrospectively, then 5 years back in both the society, who were the residents that I need to find out. Otherwise, it will be difficult. So, in retrospective cohort study, need to define clearly who were the people at entry point of time. Right? So, we can do retrospective cohort study. We can do retrospective come prospective study also. So we can combine this also, but that requires meticulous. We recall that at a particular, let's say I want to start retrospective from 1/1/2021. So at that point of time, what were the situation that we need to find out? Yeah, Bhopal gas victims. So in that case, uh, we today also we can from retrospective and cohort that can be easily done. If you remember, the medico forensical has done the best study for as far as Bhopal case is concerned. Now the steps are very simple: selection of study subjects, right? Obtaining data on exposure, and then follow it up. And when you follow them up, meticulously try to write down incidences in both the groups and then compare. Here you will have relative risk also. So in this analysis, we can see that we are interested in analysis part. This is A upon AB. Out of total exposed, how many were the cases? And not exposed, how many were the cases? And now this exposed and not exposed, that will be our relative risk. This is how, and the relative risk is automatically calculated by AP info. When you analyze this by table command in AP info doesn't know whether you are doing the case control study or a cohort study or randomized control study, or this is the data about sensitivity and specificity, doesn't know anything. That's why AP info will give you all kinds of data analysis possible, and that's why the interpretation is by us that which data we should be taking. Now, if this attributable risk is so important that if you remove this factor, what is attributable, or in a simple word, contribution? Contributor risk. If you use the word contributor risk, how much is contributed by factor? This. So if you take IE as a total exposed, in that you remove the factor which was not exposed, then exclusively you will have the percentage of the variable which was affecting or factor which was affecting. I will give an example. If you have 100 rupees with you and 40 rupees is given by mother out of 100, so 100, if you remove minus 40, then 60 rupees was given by the parents, like this. So if you remove the factor O, O means others. Others will also have this thing. That means if you remove that vector, accessively the factors which is affecting will be there. And in case of logistic regression analysis, you will get this automatically. In population attributable risk, the I will give an example and let's see whether you will be able to answer or not. Uh, the tea is consumed by 95% of the people. Alcohol consumed by 2%, and then tea is harming, let's say, um, 10%, arbitrary, 10 units, let's say 10 units. Alcohol harming, let's say 40 units. That's the affecting. Now, in this case, if you make a multiplication, how much tea is harming the population, how much alcohol is harming the population. In population attribute risk, it means that if you remove that factor, if you control that factor, what will be the situation in the society? So seemingly we say that alcohol is more harmful than tea, agreed. But in the population, if more people are consuming tea and that is also in high doses, then tea may be more harming to people compared to the alcohol. This is possible. So population attributable risk is calculated to find out what will be the advantage of removing that factor from the population. So you need to understand the relative risk, odds ratio, and attributable risk, a case control study. So next time, we'll give a 10-15 minutes on randomized control trial, and the further data analysis will be there, and also some of the research designs, more sampling techniques. So the next session will be on the some part of the statistics, some part of the research design, case control cohort cross section, and then how you are going to get do a sampling technique, right? So mixture will be there of the next session, and I would hope that you keep your data like this, no data ready. Your the questions are ready, that will be better. So I think some of you should start sharing your data also, or if possible, Google Form also. Next time, if I forget, at least maybe after 1 or 2 days, someone may post me that I will share with you lifestyle scoring data. So you can write, you can fill up that form. We'll try to do the analysis that how is the lifestyle score of the people, right? And you can give that form to others also, so that people will be able to evaluate their lifestyle score. Of course, it's a very lengthy process. The 60 questions you need to answer. It will take half an hour or so, but very interesting to evaluate your own lifestyle. Any question? Okay, let's call it a day. Uh, it's very good that you have shared the data. It's very good. So, if someone of you want some kind of help in data analysis, etc., you should share the data, even if in data personally also, I will be giving you hint how to do it, right? In the current data, you had kept the first row as blank. First row is always a header, never keep it blank, right? Thank you.